Hi, I'm Shelly Bussard. I'm a director of school of nursing at Bowling Green State University, and I just want to talk a little bit about reflection and the importance of reflection with developing clinical judgment with our pre-licensure nursing students. So much of my research and publications have been on reflection and clinical judgment. And one of the big things about reflection is it really helps our students to kind of self-reflect and understand where they are, what they were doing, and how they're going to improve in the future. And a lot of us think about reflection with debriefing and simulation or post-conference, and we'll think about what we did wrong. And the students automatically want to go into the negative aspect of it. And many times it's okay to do that. Many times the simulation portion or the debriefing portion comes with some tears, and students are very emotional. And it's okay to let them get that out because they know they did something wrong and they want to allow that emotion to come out of themselves. And that's okay. We don't want it to be a complete focus of the emotional portion of it. But many times what we're really trying to do in that reflection period is to help them understand also what they did well. And when I did something well, how do I want to use that to move forward with my next patient assignment or the next time I'm in simulation? And if I did this intervention right and I prioritized this intervention correctly and I understood this information correctly, how then can I take that and apply it in the future when I encounter a similar situation? Or compare and contrast. I had this patient in clinical that did this, and now I just took care of this patient in simulation who had a very similar diagnosis, similar labs, but we did an intervention slightly different. And now we come together and reflect about that and why did we do it differently? And that helps the student to understand, compare and contrast the different situations, the environment that they were in, the age difference that they might have had with that patient, maybe the medications they were taking, and so forth. So reflection is a really important piece. And we can tell our students to reflect in action and reflect on action. In Tanner's clinical judgment model, there's two types of reflecting. Reflecting in action is when we're doing it in the moment. So think about you're putting sterile gloves on and you contaminate your gloves. In action, I notice I'm doing that. I need to stop and get new gloves. Reflecting on action is after the fact. So it's in that post-conference time. It's in the debriefing time. It's in whatever type of reflective activities you do after your clinical or after your simulation. So many times we have our students do clinical paperwork after they're done with clinical. That's a reflecting on action. If we do a reflection journal after simulation, it's a reflecting on action. But one of the things we want to make sure when they reflect on action is they have good guided questions in their reflecting period. So think about, what is your conceptual framework to guide your school? What is the type of clinical judgment model that you're using? If you're not using one, think about one that you might want to incorporate. We use Tanner's model at our school. And then asking them questions that are guided towards that clinical judgment. So what did you notice? How did you interpret? How did you respond? And think about different ways of asking questions to get to those bottom lines. So we also use Caputi's framework for teaching clinical judgment. And she's got 23 different competencies to help us teach the clinical judgment aspects of noticing, interpreting, responding, reflecting. And then you can gear the questions based off of that framework. So things such as you walked in the room and you scanned the environment. What did you notice? When you did your assessment, what did you notice? When you were interpreting your data, what did you recognize as important or not important? When you compare two patients, let's compare and contrast your patients. What was some inconsistent information that you identified? And then that helps to interpret the information. So really, when you're doing the reflecting, think about guided questions to help them reflect. The point of it is to be very meaningful for them so they can take that information and transfer it into the future, into other patients that they care for, whether it's similar concepts, similar diagnoses, whatever the case might be, so that they have a better understanding moving forward on what they either did well or areas that they need to improve on to make their future care better. Thank you, and I hope you found this enjoyable or beneficial.